you so much for joining me here with Beauty Therapy by Absolution. My name is Julia Edgley and I'm a homeopath, and today I'll be continuing my series of face mapping and facial analysis. It's a method that I've adapted from Ayurveda, traditional Chinese medicine, and my experience with patients, and also standard medicine and what symptoms I look for that present in a patient's face. So they wouldn't be seeing me for these symptoms, but maybe I would notice it and I would ask questions. So today we are going to talk about everything around the eyes. Now, what are the symptoms I am observing in a patient? We're looking for wrinkles around the corners here. We're looking for thinning or thickening of the eyebrows, pain when we press in here in the eyes, yellowness of the eyes, swelling underneath the eyes, or a patient that has frequently blinking that indicates a dry eye. Now, when I see these symptoms, what am I going to do? I'm going to ask the patient symptoms around their liver and their gallbladder, especially women. So I'll be asking questions such as acid reflux, how's their digestion, do they have any shoulder pain or pain in this region of the body? Now, what is this indicating? As I said, it is a liver and gallbladder issue, especially if you have swelling of the eyes. I'm going to want to know if this patient is experiencing food intolerances. It can be a very slight food intolerance that we might have to eliminate for a few weeks just to take off the pressure off the liver. I'm going to be asking if the patient is using quite a few medications such as the pill or Doliprane, which we use in France, painkillers, how frequently the patient is using this. I'm going to be asking about pollutants, environmental toxins. Now, the other thing I want to ask about is if the patient is suffering from dry eye. I'll be asking about, unfortunately, their coffee consumption or globally their caffeine consumption, such as chocolate, dark chocolate, black tea, green tea, coffees, globally in a day, and I will ask the patient to limit this. Now, there is an autoimmune disorder that can cause dry eye, so if it's persistent, check with your doctor. I also want to mention as well the thinning of the external part of your eyebrows. If you are experiencing this, medically that is an indication of a sluggish thyroid, so do check that out with your doctor. And I can notice it in women who have just had babies. If you find that you have a symptom but your thyroid on paper is fine, look at other aspects of your health and well-being to see why your thyroid would be sluggish. So what are you going to do if you have these symptoms and you have symptoms of a liver and a gallbladder pressure? So what I would recommend is you're going to follow these rules for 3 months. It takes 3 months for the liver cells to renew themselves and to clean themselves out, and this will have an impact on your gallbladder. So I want you to eat very simple for 3 months. Fruits, veg and protein. Nothing drastic. Greatly reduce the sugar, the alcohol and the chocolate and the caffeine. But keep it very simple for 3 months. There are other herbs that you can take, but also depends on your medication. If you have persistent symptoms, do work with somebody. It is very much it works in your favor because quickly a practitioner will identify what is the imbalance in your body that is manifesting in these symptoms around the eyes. Thank you so much for joining me. I'll talk to you next time for the next section of face mapping.